People can be diagnosed with a genetic condition at any point in their lives. You may have been diagnosed even before you were born on the basis of prenatal testing. Sometimes babies are diagnosed in the newborn nursery before they even go home. Sometimes people are diagnosed as children, teenagers, adults, or even much later in life.
When I talk to families about genetics, I usually try to compare our genetic instructions to a cookbook or a book of recipes. And the different recipes determine how your body is formed and how it works. So if we're suggesting that a child may have a genetic disorder, we're usually saying that either there's too much or too little information in a part of the cookbook, or there's spelling mistakes that would prevent that recipe from coming out the way it should be and causing the problems that we're seeing in the child. Whenever we think of our genetic information, we think of it as coming in pairs, where one copy of the gene will come from the mother and the other will come from the father. So when we talk about genetic disorders, if you have a change in one of the pairs, whether it be from the mother or the father, that one change is enough for the person to actually show the features of the disorder. There are some disorders, however, where you need to have both copies have an actual mistake in the gene for you to have the features of the disorder. The mother would be a carrier of one of the changes, and the father would also be a carrier, and the child would then have to receive both altered copies in order to be affected.
Basically, my dad didn't know I was born with OI, and evidently it runs through my family, my whole entire family.
Oftentimes what we'll do is we'll talk about doing either testing for both parents, for that person's parents, to help us to figure out if that's a significant change or not. But as we get better at understanding the function of genes, our knowledge of genetics increases almost all the time as we go forward, which is why we like to see folks back in our genetics clinic at least every couple of years.
All of these patients who we usually see, they have multiple medical problems that stay with them throughout their lifetime. It has been useful to have a group actually identify these different doctors in the adult world where the process can be made a bit smoother. A patient with Down syndrome has a risk for thyroid disease for their entire life, and there's no one who can tell you exactly when it's going to happen. So it is oftentimes important to have not only the subspecialist, but actually have a primary care doctor who's familiar with this genetic disorder.
As an adult, we expect, from a medical point of view, we expect that you will be able to take care of yourself as much as possible. So some of the things your parents or other people may have done for you in childhood, managing your medications, knowing your medical issues, that kind of thing, people will expect you to do as much as possible as you enter adulthood. And that's a very important part of being an adult, is getting that degree of independence and responsibility for yourself. And that means that as you get older, you also will be thinking about things like having a job, having a family, and other things that go along with adult life.
GINA, or the Genetic Information Non-Discrimination Act, was passed in 2008 to protect families who have either a family or personal history of genetic conditions from any sort of discrimination that might occur in either employment or insurance. So for example, families under this act are protected from any sort of issues with moving up in employment or gaining employment based on pre-existing or family history of genetic conditions, or with regards to insurance, any sort of changes in terms of coverage or premiums that might occur.
I don't think that Williams syndrome has held me back at anything I want to do. Next week I'll be starting at the University of Delaware for a 2-year program.
My advice is keep going, keep thriving, just keep going. Just Do what you do. Don't let the disability hold you back. This is what I did. I didn't let it hold me back. I kept going. Just kept going.
I feel like that anything that comes at me, I can turn around and make it positive in some way.
When I think about Abby's future, I do get emotional because I'm just so proud of her and all that she has to give to the world. She wants to work with young children, and as more she learned about her disabilities, the more she wanted to work with special ed kids and help them. She's already doing Future Teachers of America, working with younger kids. She's done some camps, and the young kids just flock to her.
Find out what works best for you and just fight for it the best you can.